Maharashtra's food safety crackdown has seen a visible change on the ground level. But beyond the raids and the closure, what lies is a bigger question. Why was this allowed to grow in the first place? Was it related to administrative priority, enforcement, or political will, or lack of resources? To answer all of these questions, we are joined by the man himself, FDA Commissioner Tukaram Mundhe, who is at the center of this crackdown and a talking point across Maharashtra. Thank you so much, sir, for joining us here on WION. Let me start with the bigger picture. You and your team have uncovered violations at a massive level in the span of 2 to 3 months alone. I want to ask you, sir, has this been a problem for a while now, or when you took charge, why did you feel that this was something which I have to take it to a massive level?
I think that's the job of FDA. We are a regulator, so in a food and drug sector. So, as a regulatory body, regulatory institution, we have to ensure that regulations are implemented across the sector, and if there are any violations, we act against those, because ultimately it is not about crackdown, it is about the health of the public. So, public health is of paramount importance, that is ultimately outcome which we desired. In that interest, this act, rules and regulations are framed, and our job is to implement those. Yes, we are trying to do that. Now, when I joined, we took a view on it, we went deeper into it, and we found that this needs to be taken in the mission mode approach, and that is where we started working on mission mode approach sector by sector, and that is how we are proceeding.
Sure. So why hasn't food safety been an administrative priority? Do you think there are a couple of reasons behind it? Is there because of lack of resources, or maybe lack of officers, or maybe because we have less testing labs or testing capacity, or at the end of the day is it about the political will? What do you think was really lacking so far when it comes to the massive crackdown that has taken place?
I believe we have to understand in a context. See, before 2011, we had a Prevention of Food Adulteration Act. The whole focus was on preventing adulteration. As this new legislation came into effect in 2011 about safety and standards of the food. So, that is the whole transformative approach was adopted by Government of India and of course, by the states. So, once this started rolling, we needed a system in place. Earlier system was for preventing adulteration. This system talks about implementing standards and safety of the food. So, this whole approach towards regulation and its implementation underwent transformation, and this regulation did not come in a one day. It started with 2011 Act implementation rules, and then over a period of time regulations have come in place. So, there are almost now 22 types of regulations which are existing in food sector. So, as these regulations go on and standards improve and standards are in place, the implementation go on improving about it. Implementation will be stricter over a period of time, because they did not exist earlier. So, as a system, as the regulations went, systems is becoming taking its place. We are developing a culture whereby food business operators or licensees, what we call, they need to abide by all these standards and safety norms and regulations. So, this change is both for the FBOs as well as for the regulators. So, it will be incorrect to say that that particular issue or the reason that is why crackdown are not there. The first place and the most important thing what we, and particularly me, would expect is not to be required to take any crackdown. Okay. It will happen only when all the FBOs actually abide by these regulations. And so, this putting a system in place has been work in progress over a period of time. Now, time has come when we have a system in place, we have labs, we have officers, and we work on it. As far as the political will goes, it has already right from the beginning. That is why this act has come into existence. Without the political will, this act would not have come in existence. Regulations are there, now it is implementation. So, the issue is about food business operators as well as the regulator, and ultimately public has to be that much vigilant, so that they eat and they get what is safe and standard food.
Sure. Sir, if your team is inspecting, doing surprise checks when it and coming out with so many violations, does that mean that before this crackdown, the system was failing consumers to what they eat on a daily basis?
Please understand, because what is reported is not a complete truth, in the sense that in last 2 months almost we have inspected more than 3,000 places, of which more than 700 have been given improvement notices and around 160 odd have been licenses have been suspended. It means others were by and large complying with that. So, that will be a very sweeping statement to state that all food business operators or consumers which were eating were not as per the standards. So, yes, some of them were there, that is why they are found and they have been acted against. So, it will be wrong either way to club they are doing bad or they are doing extremely good. No, that is why regulations are there, that is why this FDA regulatory agency is there, and wherever we find that those are not abided by, we take appropriate action as per the required regulations and the clauses in it.
Absolutely. Sir, have you also identified particular food products or categories that are emerging to be the biggest adulteration risks as on today?
Please understand, FSSAI Act itself categorizes food in almost 18 categories. Some of them are regarded as or categorized as high risk categories, where there is high consumption and likelihood of substandard or adulteration or unsafe is there. There are 8 such categories, whether it is milk and milk products, meat and meat products, oil and all these things. They are already categorized, not by me, but by Food Safety Authority itself. So, that category exists, categorization exists.
Yes.
We need to work on that, and that is why we are working on it. We take more seriously, we focus more on high risk categories, depending on the time also. For example, if it is a festival season, so milk products, fried products, all these products will be looked much more stringently, much more on a vaster scale. If it is summer season where mangoes are there, so we will be looking at mangoes. So, that varies from place to place and time to time, depending on the festive season or the season of the month. But of course, all the time high risk categories of food remain quite vigilant.
Absolutely. So, are repeat offenders also a major problem? I mean, even after an FDA action, have you come across food establishments that continue to even violate even
If
after
there are
giving
repeat offenders, then we go for cancellation of the registration or license, and some of these actions have been taken. So, there will be certain things. So, they will be shown the way as per the law, they will be shut down, closed down, cancelled, just not suspended.
Sure. So, what is the most common and dangerous form of adulteration you have noticed in these raids involving life-threatening chemicals or ingredients?
So, it's any adulteration or any unsafe food is a dangerous thing. So, to categorize which is the most dangerous and which is not, it will be misleading statement. So, any adulteration or unstandard food or unsafe food is a danger to public health, and that is what we act, not about a particular chemical or particular industry or particular food category. No, anything which is unsafe, which is adulterated, which is not as per the standard, is not to be tolerated.
So, in the recent event in Pune, you also received standing ovation from the people. Of course, it was a very proud movement. But can this system really work with same intensity without depending on one officer? Because we've also seen FDA officers coming in the past, but we've not seen such a level of crackdown taking place only in the span of 2 to 3 months. So, do you really feel?
I think system and institution are much more important than an individual. So, our effort and my effort also is that we should institutionalize the things rather than making it individual centric. So, are we taking any steps in that direction? Yes, we are taking the steps in the directions. My priority and my office's priority is basically to put a system in place so that it becomes self compliant. So, when we act against defaulting FBOs or licenses, what we are expecting is a compliance from them.
Sure.
And the compliance cost should be lesser than the non-compliant one. That message has to go into the market for the FBOs and even for the individuals for that matter. They should eat only standard and safe food, not so called like it or not like it kind of a food. So, we are going for automation. Many of the things we have already moved on digital mode, and that's how this even grievance redressal mechanism we have started on a new portal, where is the portal is complaints.myfda.in. So, nobody needs to visit any office, call any officer for raising the grievance. They can just do it on their mobile and they can track their complaint. So, these are the system which will be lasting long. They will be lasting just not me, my tenure, but they will lasting as long as this regulatory authority exists. That is how we are building in check in and check what you can check and balances. So, the involvement of citizens is of paramount importance, of the stakeholders is of paramount importance. So, grievance is one system, regular reviews is other system, periodical inspections is a third system. So, we are in a process where systems we will put in place and they will be placed permanently and those will be institutionalized. So, whether officers come and go, systems will take and institutions are strengthened. That is how we look at it.
Absolutely. So, last couple of questions. We've also heard reports about now, since you've started doing surprise inspections, the restaurants have become quite cautious. They are getting into deep cleaning. They're also getting into all hygiene mode, which were not really there before. They've started putting banners and posters right outside the restaurants saying that we are complying with all the FDA rules. So, of course, there is a visible change. But we've also heard another important angle, that how these establishments, some of them are hiring ex-officers to get themselves saved from the raids. What do you have to say on that?
I do not know whether hiring ex-officers will save them or not, but definitely complying with regulations will definitely save them. If they are hiring for knowledge or advice from them, that is fine enough, but those who are hired also should know the laws and rules and regulations. Their job is to give them a right advice. If they are tendering something not right, will backfire on them and abuse also. So, what is of paramount importance is all the FSI regulations. I say 22 example, maybe tomorrow there are some more, whichever are applicable to that particular FBO, they have to comply with that. If they do not, they are under any time under the radar. If they are complying, they have nothing to fear. If they do not comply, whether they hire one ex-service or other one or private sumper or lawyer, it is not going to help them. So, the message is clear and loud, whether you hire X or Y, it does not matter. What matters is compliance with the norms and regulations.
Absolutely. So, my last question to you will be, when you do a massive crackdown like this, it is, thought of that, are your officers ever been given bribes maybe to soften the inspection, or maybe faced any political pressure from the higher level to, not really anything?
There is no question of any pressure, because government is very clear about this, that we cannot tolerate and we will not tolerate. Our policy of zero tolerance of unsafe and substandard or adulterated food, there is no question about it. If somebody tries to give the bribe, that is a crime. Somebody who accepts is a crime. If anything of such things are there, they can approach me or they can approach anti-corruption bureau. They are there. We will take stringent action against those both who are giving, because as per the act there is amendment, and as you know, yes, that is in place. Both the bribe who is offering the bribe and those who is accepting, both are criminals, and we will deal with them as criminals.
Thank you, sir. One last question. Any shocking discovery that has come to light during inspections or during raids that you did not expect, but you think the consumers should know?
See, not abiding by FSI regulation is the thing, and particularly unsafe food, whether it is medicines or spurious or whatever in food sector, is not acceptable, because it is affecting not only the health of a particular individual, but it is affecting adversely the future generation of India, and that is what I am really against. Nobody has got any right to spoil life of an individual, society, or a nation for that matter.
And what is that one message that you want to give the consumers who are watching you right now?
I believe that consumers must be vigilant what they are eating and what they are purchasing. They must read not only what is the expiry date and the price, but the ingredients of it is, what constituents it has. If you start reading that, then we will be much better and healthy society. For example, for simplifying things, we categorize in 3 colors as we have in signals: green, yellow and red.
Yes.
Green is go, you do not have to worry about it, is about leafy vegetables, proteinate food, all these natural things. Yellow is you have to be cautious, you have to take it sparingly sometimes. Red is absolutely no. Same way, there is a categorization of food, go for green, sometimes once in a while you can go for yellow, red is absolutely not.
Thank you so much, sir. It was wonderful having you here on WION, and a simple message for all the consumers out there: be vigilant, do read out the ingredients before you consume any food, be it even in big establishments or small establishments across the country. With video journalist Siddesh, this is Disha reporting from Mumbai for WION World is One.